Well, now we're going to be talking about Parkinson's disease and specifically how the substantia nigra compacta plays a role in modulating the go and no-go pathways. The substantia nigra compacta releases dopamine. The effects that dopamine have on D1 and D2 are different, and here's where these come in. This one has a positive effect, while this one has a negative effect. So this is a good arrow, and that is a good arrow, and that's a bad arrow. Dopamine is released in two different ways. You have tonic and you have phasic. And now I'm going to have to explain to you the difference between those two in order to understand why dopamine works differently in both the no-go pathway. We're now going to talk about tonic and phasic release. Dopamine via the substantia nigra compacta. Tonic is volume transmission. So the volume transmission gets released into the caudate and putamen. It will then bind to specifically the D2 for tonic. It'll specifically bind to the D2 because it has a higher affinity for dopamine. But the dopamine's effect on the D2 is an inhibitory effect. So what happens is, when dopamine binds, it weakens or dampens the signal of the effect that it has on the GPE. So it reduces it. So it kind of self-regulates when you're having volume transmission of dopamine. This is kind of a good thing for the go pathway, but right now it's not good enough. So with volume transmission, it'll specifically bind to D2s because D2s have a higher affinity. It'll dampen the signal that the D2 is affecting the GPE. But now there's also phasic. And phasic is not through volume, it's through like bursting of dopamine. So this is like bursts, not normal volume transmission. And with this, we do see that dopamine is able to then bind. So phasic will go here, tonic will go here, and I guess phasic will go to there as well. But now when phasic goes to the D1, it has an excitatory effect on the D1, increasing its ability, increasing its function. And its function was to suppress the GPI-SNR, and it suppressed the GPI-SNR through GABA, but because we have dopamine bound to it, it increases the strength of its ability to dampen the GPI-SNR. This increased strength, with the addition of this pathway kind of inhibiting certain areas of this, will yield a smaller arrow of inhibition onto the VAVL, allowing for the movement. Wrong thing. It's green because it's good, but it is a glutamatergic response onto the cortex, resulting in movement of lower motor neurons. So that's how dopamine is able to, in a phasic load, is able to then positively help the D1 neurons by increasing their ability to dampen the GPI-SNR. That's pretty much the whole process. One more thing I will want to mention, just so there's maybe some clarity. The subthalamic nuclei, when they go into the GPI-SNR, they are more diffuse. So if you look at this, it would be the GPI and the SNR. So if we blew up the GPI, so it's this structure, and you have two. I didn't duplicate it because it's there, but you have the GPI, which looks like this structure, right? That's this one. So you have the GPI. You have your subthalamic nuclei. Sorry it's taking so long. You have your subthalamic nuclei, and it'll go transiently throughout the entire, more or less, GPI. Whereas your D1s, which are going to be having a GABAergic effect, are going to be localizing in a specific area. So when this whole data is being sent to the VAVL, it'll look like this. It'll be, because you're activating this and you're inhibiting this area onto the GPI, it'll look like this. It'll be like strong here, and then like a little area not as strong. And so that's how it would kind of work. So the body would know specifically what area, because the orange turns into a blue signal to go to the thalamus. And no orange signal would be a lack of a blue signal, which is what I'm showing right here. So because of this, we see that there is this somatotopic organization or what have you to help show the VAVL which specific areas the D1 is showing are not inhibited within the GPI SNR. Hope that helps. Sorry if there's any confusion. Please comment below if you have any questions or directly message me. And I hope that helped. Bye.